This is a presentation by the Centre of Research Excellence, or CRE, in Health System Reform and Integration, part of the Mater University of Queensland Research Institute. My name is Dr. Lisa Crossland and I am a Senior Research Fellow with the Centre. I've worked in primary healthcare and general practice research across Australia for over 15 years in urban, rural and remote general practices and primary healthcare clinics. Our work in primary healthcare organisational improvement commenced in 2012 and continues nationally in partnership with the RACGP, the Primary Health Networks or PHNs, the Australian Association of Practice Managers and the Australian Primary Healthcare Nurses Association. We also continue international collaborations in relation to the healthcare home. The most recent work we have completed has been the development, pilot, trial and validation of a simple-to-use organisational improvement process designed for general practice and primary healthcare. This involved working in a co-creation approach with a range of general practices, practice managers and GPs, as well as our previously described partners, in order to meet their specified needs. While we were all aware of existing quality improvement approaches that focused on clinical care, we knew there were limited strategies which focused specifically on assisting practices to reflect on and improve their organisational function. Why did we choose this focus? Well, for general practice and primary healthcare, we do know that the one constant is change. There is, however, continuing focus on the importance of effective and efficient primary healthcare delivery, an emphasis on new performance measures, and now a movement toward the healthcare home model. In order to ensure that improvements are part of the dynamic culture of primary healthcare, we believe that all staff should be engaged in identifying, implementing and sustaining improvement in their practice. With all this in mind, we developed the Primary Care Practice Improvement Tool, or PCPIT, a simple three-stage strategy using a whole-of-practice approach which focuses on elements that are integral to high-quality organisational performance in general practice and primary healthcare. The PCPIT process can be used by high-functioning practices with extensive experience in improvement activities, such as the collaboratives, or by those practices with very limited experience in quality improvement. It has been trialled in urban, regional and rural practices and in a range of practice sizes and business models. The PCPIT elements have also been mapped to the building blocks of the healthcare home, and so provide a means for practices to begin a transition or reflection on how they function as healthcare home models. This is part of an international refocus on patient-centred and coordinated care. This presentation will cover the 5 key topic areas: what the PCPIT is and how it works, 6 steps to using the PCPIT process in your practice, a recap of the key activities which I'll describe in this presentation, benefits of using the PCPIT as identified by our practice managers and GPs, and how you can register your interest in using the PCPIT. So, what are high-quality organisational performance elements of general practice and primary healthcare? We have identified these 7 main elements with an additional 6 sub-elements that give us 13 key elements integral to high organisational performance. These are elements that have been identified from national and international literature and are common to and demonstrated by effective and efficient general practices and primary healthcare services with patient-centred approaches to care delivery. Each element is defined and explained with an accompanying best practice definition, but we present a summary of the 7 elements here. The first is patient-centred and community-focused care. The second is leadership and leading, that is organisational as well as clinical leadership, and opportunities for all practice staff to take a leading role in making an improvement within their practice. The third is governance, broken into the 2 sub-elements of organisational management and clinical governance structures. The fourth is communication, broken into 3 sub-elements of team-based approaches to care, the availability of information for patients, and the availability of information for staff, that is both clinical and administrative information to enable staff to do their jobs most effectively. The fifth element is change management, broken into 3 sub-elements: a practice's readiness for change, the education and training a practice uses to support change, and incentives within a practice to sustain change. The 6th element is performance, broken into 2 sub-elements of process improvement, or improvements made to a practice's daily workflow, and performance results, or a practice's ability to reflect on quality data and information to make improvements in practice. The 7th and final element is information and information technology. That is a practice's collection and management of high-quality clinical and administrative data and its effective use of information technology within the practice. This diagram represents the PC-PIT elements as part of a practice. The basis being patient-centered and community-focused care, which supports 4 key building blocks of leadership, communication, governance, and change management, held together by the mortar, which is the collection and management of quality practice information and data and the use of information technology, all leading to the roof or the pinnacle, which is the use of this quality practice information and clinical data to reflect on and improve practice organisational performance. The PC-PIT process unites those elements of high-quality organisational performance with what our practices, that is practice managers, GPs and also practice nurses, and our partners described as being most important to them in an organisational improvement tool. That is, a tool that should be online or, if completely necessary, paper-based, that takes a whole-of-practice approach, that links to but doesn't duplicate existing improvement activities such as accreditation or other clinically based improvement programs, that can be facilitated by practice managers as an internal process without the need for expensive, time-consuming external facilitation, that has additional, simple-to-use supporting tools and resources to assist practices to make and measure their improvements, and that has external support and guidance available if required. There are 6 simple steps to using the PC-PIT process in practice. The first is to watch this information presentation and to register your interest with your PHN. A link to the staff PC-PIT and instructions on how to complete it will then be sent to you via email or, if necessary, as a paper-based form for you to distribute to all your practice staff. All practice staff complete the PC-PIT by ranking how they perceive their practice performs against the best practice definition of each of the 13 elements. They do this by using a simple 1 to 5 sliding Likert scale, and all their answers are completely confidential. You or your nominee, such as a practice nurse, then completes a separate review of the documented practice evidence which addresses the same 13 elements by completing a paper-based evidence review form. This enables a comparison to be made between how your practice staff perceive and score the elements integral to high-performing practices and how the same elements are supported using the documented evidence in your practice. The completed evidence review form is sent back to the CRE, which uses your form to rank each of the elements using a similar 1 to 5 Likert scale. All your practice data is entirely confidential. Using these Likert scores, a confidential 4-page PC-PIT report is prepared by the CRE and sent back to you and also the principal GP. The report presents the aggregated median staff PC-PIT scores and the scores from the evidence review form in 2 simple-to-read side-by-side spider diagrams. The report provides detailed information on how to interpret your results and also identifies the lower and higher scoring elements in your practice and potential areas for improvement you may wish to focus your discussions on. Using your PC-PIT report, you can then facilitate staff brainstorming discussions following the Plan Do Study Act guide in order to identify a specific area for improvement. You will receive the PDSA guide at the same time as you receive your PC-PIT report. With your consent, the PHN can provide external support and assistance, including help with your PDSA. There is also an additional suite of high-quality tools and resources related to each of the PC-PIT elements which are available to support you as you undertake your improvements. These tools and resources have been selected by an advisory group of practice managers and GPs as being simple to use and of most relevance and usefulness to organisational improvement in general practice and primary health care. They contain a specific tool to review and assess elements of patient-centred and coordinated care as part of the healthcare home. These tools can be provided to you as part of the support available through your PHN. This is an example of how the PC-PIT staff survey looks online. This is the element of patient-centred and community-focused care, with the best practice definition at the very top, and the sliding Likert scale beneath, where 1 reads, "I do not believe our practice takes the patient-centred care approach as described," through to 5, which reads, "We always work together to ensure our patients can access comprehensive, coordinated care. We work in partnership with all services within and outside the practice. We use best available clinical guidelines. We focus on the health of our patients in the context of their families. We have a system in place to enable patients to have input." Staff are also able to tick the "not applicable" box. They can choose to do this if they believe the element is not relevant to their area of work. While the online survey doesn't ask staff to record their names, it does collect basic demographic information, which includes their general role in the practice, the length of time they've worked in primary health care, the length of time they've worked in that specific general practice, whether they are part-time, full-time or casual, and if they are a contracted or permanent member of staff. Once staff have completed the online PC-PIT survey, step 2 is for you as the practice manager or your nominee, such as the practice nurse, to complete the paper-based tick box evidence review form. The evidence review form addresses the same 13 elements as we discussed and enables a comparison to be made between staff perceptions and what the evidence in practice demonstrates against each of those best practice definitions. The Plan Do Study Act or PDSA approach is very simple and provides you with an easy-to-use framework to guide you in defining, planning, undertaking and reflecting on the outcomes of your chosen improvement. It will ask you to document the strategies you will use, the time frame within which you will make the improvement, the measures to ensure the improvement has been made, and it will also ask you to specify which staff have the responsibility for carrying out the activities to achieve your chosen improvement. You can use this PDSA plan to guide you in undertaking the improvement itself. It is also possible that there are specific and formalised programs being undertaken by your PHN which may be relevant to your chosen specific area of improvement. If so, the PHN will offer these to you as a potential alternative to completing a PDSA. They will continue to provide support through this process. However, this will be entirely your choice and can be discussed with your PHN at the time. This is a summary of the key activities for using the PC-PIT process within your practice. The PC-PIT staff survey link will be sent to you as the practice manager. You can then on-send the PC-PIT staff survey link or distribute a paper-based copy to all your staff. All staff then complete the PC-PIT staff survey. As the practice manager, you or your nominee then complete the paper-based evidence-based review form and return that to the CRE. A confidential PC-PIT report is prepared by the CRE and sent to you as the practice manager and the principal GP. You can use the PC-PIT report to facilitate discussions, identify and choose a specific area for improvement. You can then use the Plan to Study Act or PDSA guide to define, plan and measure the outcomes of a specific improvement supported by your PHN. Using your PDSA, you can then implement and review the improvement, also with the support of your PHN. Once you've completed one improvement, you may perhaps wish to revisit your PC-PIT report to choose a second area for improvement. There are several benefits in using the PC-PIT process that have been identified by our practice managers and GPs. That is, that the PC-PIT takes a whole of practice approach and is seen as non-punitive, and that it's also been designed specifically by general practice for use in general practice and primary healthcare. That it's applicable to practices at all levels of experience in organisational improvement activities, and that it provides a process to assist practices to achieve and also sustain accreditation requirements. In addition to these benefits, the PC-PIT elements are now also mapped to those of the healthcare home. There is access to a specific supporting tool to help practices assess how they presently function as healthcare home services and what areas they may wish to focus on in the future. It comes with active and expert support from the PHN. And finally, there are 50 points for practice managers available through the Australian Association of Practice Management and 40 Category 1 points for GPs available through the RACGP. In order to register your interest in using the PC-PIT or to commence the PC-PIT process in your practice, please contact your PHN or email me at the CRE at the email address provided here. We thank you for your attention and we look forward to working with you.